And we are very far to get the real picture now, and we should work together to go in this direction. So COVID-19 also has also impacted many other things. And my reconnaissance or my, my feeling to millions of women who are still working very hard during this pandemic, who are also challenged by the menstrual health management. We should not forget women working in healthcare facilities, particularly. Those include doctors, nurses, and janitors, garment factories, farms, small restaurants and food industry, food store, and people, patients visiting healthcare facility, pregnant women. Those women are totally as well affected. We should not forget them. We should pay a huge attention. Can you all mute? Can you mute? Can you mute your phone? Your microphone, please. Can you mute? Okay, great. Thanks. So I just want to say a few words before I give the floor to them. So those women living in emergency situation by COVID-19, before COVID-19, they are also centrally in the prevention of menstrual health management due to the shortfall of supply, also in a hygienic, and safe management of menstruation. We need to act differently now by innovating, by releasing menstrual health management burden on millions of girls and women. Menstrual health is not only women and girl issue. It includes men as well as society. It's multifaceted, multidisciplinary. Menstrual health is in time of COVID. It's about innovate. How do you innovate, right? How do you innovate? How do you work? Change the whole situation in terms where everything is locked down. Different approaches, different system, innovative finance, extra effort, innovative supply management are totally needed. So I just want to conclude my remarks, say two things. Menstrual health management is, in time of COVID, is about innovation and genuine partnership. So today webinar will focus on how do we celebrate the day celebrating innovation in menstrual health and hygiene in a time of COVID. So for that, we have few presenters. The first one is Anu Ogotam, was specialist in Unicef AirPro. She'll have a brief overview of regional reality on menstrual health and hygiene. So she has more or less 10 minutes to talk. Over to you, Anu, if you can upload your presentation.
Thank you. Thank you very much, Eva. So let me upload my presentation. Where is it?
Okay. So if you have any question, any point to raise, you can still raise in the chat box as we go along. We continue discussion. And welcome again for this.
Can you see my screen?
No, we cannot see.
Okay, yeah, it's been uploaded. Okay, let me do the display settings. Is it fine?
Yeah.
Okay, thank you, Eva.
We cannot see, still we cannot see.
You cannot see it?
No.
Oh.
Okay. Maybe you.
Do you see it now?
Yeah, that's fine, yeah.
Do you see it now, Eva?
Yeah, we can see, we can see.
Let me just do the video settings.
Okay, you can start. You can see the video.
Okay, sure, yeah. Good morning, everyone, and a very happy menstruation hygiene day to all my female colleagues, to all the girls around the world, but also to all the male champions like Everest and yourself, who are really participating in this menstruation hygiene day celebrations today. But am I on the first slide?
You are on the second one, second slide.
Okay, that's you know, we now know that there are many studies done on menstrual hygiene to understand the perceptions, to understand the barriers faced by girls and women across the world. And as Unicef, we had done a study back in 2017 to understand more the perceptions, more the issues related to menstrual health and hygiene in the region. And it shows that some of the findings are very, very starking. To help us design a program that addresses the needs of women and girls. And so the first one is about the lack of information about menstruation, whereas in the region, some of the countries have very high rates where girls do not have any information about menstruation or menarche, their first periods. Nobody's talking to them about what happens and why do they get it and what happens and anything on the reproductive health and hygiene. This is as high as 97% in Lao PDR. So there are also many issues related to around many myths and taboos that are very, very widespread in the region. You see it, Eva? Are you seeing my screen?
Yeah, perfectly. So it's
okay. So there are many myths, and these myths are like, what I notice is that these are mostly guided by the element of fear, where there's a fear element which says that if you do this, this is what is going to happen. If you do that, this is what is going to happen. And there are many misconceptions which really impacts the lives of many girls. Like one of them, for example, is like for Papua New Guinea, it says that don't collect water or don't touch water. And this is also very, very prevalent in a culture like where I come from, in a Hindu society, that there are many restrictions on girls and women during menstruation. So, and the other one is in Vanuatu, it says that don't tend your garden. So it says that, you may be limited of many of the interests that you have during menstruation. And it is very important to demystify these myths. The third one is related to the dietary taboos. So during menstruation and in normal times as well. Hello, can you please mute your mic, everyone? So in terms of the dietary taboos, the young girls and boys, when they are growing, they really need very nutritious food. But if there are restrictions on them during 5 days of their menstruation, this is going to have a huge impact on their nutritional status and on their overall growth and development. There are issues like, for example, in Myanmar, the girls and the women during menstruation cannot have some of the fruits like bananas or green leaves or green vegetables or plums, which again has an impact on their dietary intake and their overall growth and development. The other one, very critical one, is that the information related to hygiene and the management of the menstruation is miscomprehended or misconstrued, where like there are certain cultural norms that tells women and girls to do certain things and not to do certain things. So in Cambodia, for example, they said that you have to keep your first sanitary pad or your cloth that you use as for the first menstruation, because this will protect you from bad intentions, which is so illogical, which is so based on the common practices that is like going on for generations, where my mom did the same thing and maybe we are required to do the same thing. So similarly, many other misinformations exist on menstruation hygiene in the region. The other one is about inadequate menstrual health and hygiene facilities in all settings, and most importantly in schools, where girls spend a long period of their time in the schools. So there's a lack of wash facilities, there's a lack of changing room, there's lack of disposal of hygiene, the pads, and then there's no education about how to use them, how to dispose of them. There's no water, there's no changing room, there's no maybe soap available for girls to clean up themselves, or use it during their menstruation. So if you look at the data from the Joint Monitoring Program, the data on washing schools is very, very limited in the region. Wherever data is available, the access to water sanitation and hygiene is also very, very limited. So this is a big issue that needs to be addressed. The other big issue that's coming out of the study, and which we know also from our anecdotal, from the stories that girls are sharing, is that many miss the schools and there's a restricted participation. So in Vanuatu, 75% of the girls miss the schools, which is like 2 to 3 days during a month, which has a huge impact on their learning outcomes. This is because there are many elements to this. They are ashamed to go to school because they fear that their male colleagues or the other friends may see them, may see the stains, or they don't feel, they feel the pressure of being teased or bullied. And this comes out of the ignorance of boys and the other, other people in the school about menstruation being a subject of bullying. Similarly, they lose their dignity. They have low self-esteem during menstruation. And as a result, they feel less motivated to go to schools. And this calls for a very, very open dialogue and discussions to educate girls about the transformations that happens to their bodies as part of puberty, for both boys and girls, not just for girls, as part of puberty, as part of the changes as they grow. So this calls for increased awareness, but I'm not just going to give you the gloomy picture. There are many positive things happening in the region. One, on the enabling environment, good policy environment is there, increased coordination is happening. The menstrual health and hygiene is being growingly integrated in the curriculum, and it's a part of the school washing schools program. And of course, growingly in the recent years, menstrual health and hygiene has been integrated in all washing emergency response to address the needs of women and girls. So in the context of COVID-19, which is like the menstrual health and hygiene may be impacted because of the secondary impacts of COVID, where the supply to the services may be limited, but we really have to ensure that MHM supplies and wash facilities are in place for all the health workers who really provide us those critical services. We have to mitigate the impact by ensuring that menstruation hygiene facilities are a part of the dignity kit, are a part of our non-food item supplies. And finally, we have to ensure that there's good access to our services in terms of changing room, in terms of the use of pads, in terms of privacy, which is very, very crucial. So going forward, and based on the recommendations of the study, we see that there's a need for a multi-sectorial approach. So in terms of multi-sectorial approach, we really have to ensure that the enabling environment is there and there's a support, not only in the schools, but in the households, where there's a greater need for mothers to educate also the children, also the daughters in all the settings. And then the second part, which is very, very crucial, is to further aware and educate girls and boys to understand more about menstruation, to understand more about their body transformations, and this being just a biological phenomenon that happens to every girl everywhere in the world. And then the myths and misconceptions are basically created by the society, which needs to be broken down. Of course, there's a need to ensure supplies and services in the schools, in all settings, in the households, and also the need to provide affordable friendliness of the supplies have to be ensured. And finally, innovations, and which is all about this webinar today. There has to be innovations in terms of the product availability, in terms of the access, in terms of not just about the services or the products, but also about awareness, the knowledge, the information that needs to be translated to the girls and the boys, and we need to work intersectorally. So with this, I would like to close here, and any questions, I'm happy to answer them. Over to you, Eva. Thank you very much.
Okay, thank you very much. Thanks for the presentation, and also very nice to see some of the points that are very important: the multi-sectoriality and multidisciplinarity of MHM, and also the innovation that we are talking about. So please do put your question in the chat box, and then the presenter will respond to you. The next presentation we'll have now is from Gerda Benda from Regional Office. Gerda, over to you for your presentation.
Thank you
Gerda, are
so
you there?
much. Yes, I hope you can hear me. Thank you
Yeah.
so much for having me at this very special day and this very special webinar. Before I start, I would like to ask Anu to please stop sharing your screen because otherwise I can't pull up my presentation. Wonderful, thank you so much. So my name is Gerda. I'm with the regional office as the regional gender advisor based in Bangkok. And let me just see that I can put this on full screen. I am happy to share with you about an amazing and exciting journey and initiative that has started together with girls about 3 years ago, when we, as you just heard from Anu, had so many conversations with girls about their lives and their challenges and their dreams, and we learned how many girls don't have any information before their first period. And there's so much misinformation out there. So what we thought we do is work with girls to see what kind of information, in what way could be delivered to them in maybe new ways. I am trying to use the slides. Yes, fantastic. So you have seen the data before. It is quite concerning that girls get their first period and don't know what happens to them. And the programs that we have out there are really mostly paper-based and very top-down, so don't necessarily always answer the questions that girls have. And now we see more and more girls going online, finding access, either have a phone, a mobile phone that they own or they can share in the family. And so they look for information. They look for health information, for period information, for puberty information. And so we started working with girls in 2 countries in the region, in Indonesia and Mongolia, and used a lot of co-creation sessions to talk about menstruation and to talk about the questions they have and in what way they could actually access it online so that it is. So we didn't only speak to girls, but also their close social circles, their parents, their siblings, their teachers, boys and men, and got an insight into how girls can access information on digital platforms. And the girls really told us what they would like to see and what they want and need. So they picked a name for their platform. The name is Oki. It is a fun made-up word. And what they also told us is what this kind of application on a mobile phone needs to be specific about when it comes to girls. Because you might know there's quite a lot of commercial period tracker apps out there, but they're mainly for Western adult women. They're not particularly educational, not particularly fun, and have you know some gender stereotyping or might compromise personal data. So here on this slide, you can see that girls' digital realities are very different in low and middle income countries. And it is very rare that innovations or digital technologies really look at the needs and the behaviors of girls when it comes to using an application. So we learned if girls have access to phones, it's usually Android, low-end phones. And so that means the application needs to be very lightweight. Otherwise, they would immediately have to delete it because it would use up too much storage, especially if it's a shared phone in the family. We also understand that the literacy, digital literacy, as well as reading could be a challenge for younger girls. So the app needs a readout function, it needs tutorials, it needs a help function. And of course, one argument that many girls made is they don't necessarily have access to data or to Wi-Fi all the time. So for them, the application, you need to download it once and then it works offline consistently. So you don't have to go back online. You can track and everything sits in your app and you can use it every day without needing data. A few other insights that makes this Oki app so innovative is that it thinks about girls sharing phones, either with friends and peers or in the family. So it could be that more than one girl needs to use this app, log her periods, learn about her body. And so it has multiple user logins and is protected by passwords. So 2 and more girls can use the same app, but it's still very individualized and personalized to each of the girls. Another learning we had is girls don't necessarily have email addresses to go on Google Play Store. So an app for girls on menstruation needs to be accessible via, for example, a link or a QR code or shareable via Bluetooth. And last not least, what was so important is that the girls said they want something positive. They want fun, they want support, they want it to be friendly and colorful. So when I show you the app in a minute, you will see it's like a game. It's upbeat, it's supportive, you can play quizzes to learn about menstruation, and it has very high data protection. All the data that girls enter stay in the app and never are connected to any cloud. And they also wanted for parents to really know about this app and for teachers, community members, men and boys to support them and to learn about menstruation themselves. So the app has a function that allows everyone to just also learn about it on the website or to see what the content, the evidence-based content in girl-friendly language is about. So based on all these inputs from girls, we co-designed and we developed the software. There was a lot of amazing features that girls wanted. We had to opt for the fast version to cover the most needed features, but we made sure it works online and offline, it's gamified, and it really transforms the stress that many girls feel about getting their periods or having irregular periods or not knowing what's happening with the body, that it becomes something they can manage with confidence, with normalcy, and feel empowered. So I'll talk you through what Oki looks like. And you can see that the girls really crafted and drafted and showed us what it needs to look like. So the first thing is it's a very personalized experience. Oki allows you to choose your own friend, your own avatar, and have different background themes as you feel like. And it was really the girls themselves who picked colors, they named the avatars, they made sure that this is their own tool. An important feature that speaks also to that fear of the not knowing when my period comes, being worried to go to school and not being prepared or being surprised when the period arrives, that it has an individualized cycle tracker. So there's machine learning that tries and predicts and helps girls to show when and how when the next period might be due. But also it doesn't over-promise on periods, because we do know so many adolescent girls might have irregular periods. Most importantly, what we found was we needed to address the lack of information and also to address many of the misinformation and the myths that Anu had just presented right before. And there's two ways that girls and any user can access this evidence-based information about menstruation and reproductive health. There's the encyclopedia, where you can look for certain keywords, where you can find categories, and maybe of interest to you is also that it now has COVID-19 information. So again, translated into girl-friendly language. In each of the countries, it addresses particular misinformation and myths around COVID. So in this app, you have a chance from the backend to push push more and more content, especially what's important to girls in a particular situation as a pandemic or an emergency. You also can learn in a fun way. So quizzes, reminders, your avatar, your friend sends you notifications and supports you and encourages you and gives you tips. And there's also referrals to on and offline SRHR services and advice. Here's a snapshot of the OKI website. Please do visit it, have a look. It explains what OKI is about. And maybe as a couple of last words in looking to the future. Now, OKI in a minute, Reza will tell you, is now formally launched in Indonesia, and it's being launched in Mongolia next week. It is an app that was developed open source. So what does that mean? It means that anyone, any partner, any country who is interested to bring OKI in a localized version to the girls in their country can do that with no development or licensing costs. And that also gives an option for girls themselves to engage in developing OKI further, writing new content, amending certain features, improving the design of OKI. So this is a start of a journey that we hope will be like a global network of OKI partners who help deploy and localize the OKI app into the specific new countries. And what we hope is, and what we've seen in our development process, because it's such an innovative digital approach, that partners from all kinds of sectors of society have been engaging. Technology companies have helped with pro bono advice. Mobile operators are engaging, particularly in the new countries now. We have private sector companies helping with the digital marketing and social media influencers, and many, many more. So it has been a real exciting journey. The next step is already that the Kenya Unicef office is working with a partner with the support of the Duke Unicef Innovation Accelerator to localize the OKI app and to bring it to the girls in Kenya. On this slide, on the last slide, you can see that this accelerator program that UNICEF is leading together with the Duke University has selected 6 innovations, 6 entrepreneurs, social entrepreneurs, to bring either new products or digital solutions to girls in the Eastern and South Africa region. And OKI is one of the projects that will be rolled out by local partner, and we look forward to a lot more. And if you have any interest in bringing OKI to your country and partnering in scaling and building it out and bringing it to more girls, we'd love to hear from you. I will end my presentation here because I'd love for Reza to speak on how now OKI is being marketed and launched in Indonesia. But before I do that, I would like to show you a very short video that really describes OKI a lot better than how I can just do that. And so, one second. I will bring you. All right, so let's have OKI talk by itself.
Hi, welcome to Aki, a period tracker app for girls like you. My name is Ari. Use Aki to get to know you by tracking what's going on with your body and mood every month, and learn about periods in fun ways. Create an account and choose an Aki friend like me to accompany you. We are here for you every step of the way. This is your monthly menstruation cycle. Each shape is a day of the month. And this number is your personal countdown. It shows how many days until your next period, or how many days left of your current period. Track your mood, period flow, body, and activities with emojis on the daily cards. Write in your private diary card. Test your knowledge and take fun quizzes. Check out your calendar and see your whole month at a glance. And check out the Aki menstruation and puberty information to learn new things about your body and health. And don't forget to send me some love. Welcome, friends, to Aki. For girls, by girls, period.
So thank you so much, and over back to Everest.
No, thank you very much, Gerda. Very nice presentation. And for all of you, I have installed Oki on my daughter application. It's working very well. And then I recommend you all to do the same in for your daughter as well. So with that, let's move to the next presentation. If you have any question, please go directly to the chat box and put the question there. So the next presenter is Reza. Reza will present to us the application of Oki in Indonesia. Reza, over to you if you are there.
Thank you, Anu. Thank you, Eva, Anu, and also Gerda for giving me the opportunity to present Oki period tracker apps, localization and launching in Indonesia. Good morning, everybody. My name is Reza Indrawan. I'm a WASH specialist working for Unicef Indonesia. And I've been also working with Gerda on developing Oki since 2018 and 19. So please, next slide. Just to give you the just give you the excuse me, can you turn off the mic, please? Okay. So just to give you the background on how Menstrual Hygiene Day in Indonesia conducted, it is always a collaboration since 2017. UNICEF Indonesia working together with other development partners like Plan Indonesia, World Vision, SNV, SIMAVI, and GIZ to support online and offline based campaigns. Usually, we also involve governments, in this case, the Ministry of Education, to lead the social media campaigns. And also, since 2017, we always involve influencers, YouTubers, celebrities, activists, sportwomen, youth leaders, and religious leaders. So this is just to inform you the spectrum of people that we engage to promote menstrual hygiene in Indonesia. We also using a U-report to gather informations related to menstruation. For you who's not really familiar with U-report, U-report is a social messaging tool and data collection system developed by UNICEF to improve citizen engagement, especially for young people. So the pool result used to inform leaders and foster positive change. For U-report itself, this year, we are wondering how COVID-19 pandemic can influence girls in managing their menstruation. We tried to understand and we launched the U-report in early March. We got almost 9,000 U-reporters for this pool, and we found a very interesting findings. 26% of the EU reporters, they experience some challenge when getting a disposable pads. When we ask what kind of challenge, it is due to restrictions in movement, shops were closed, and also we found that some girls feels the price of disposable pads become unaffordable. Perhaps this comes from poor families live in urban where their parents rely on daily income jobs. We also found that menstruations during pandemic create challenge and also impact on some girls, like irregular menstruation cycles. Another interesting thing is that we found that about 50% of the EU reporters are looking on the internet for informations around MHMs. This is, I think, the opportunity for OKI as a source of informations for girls. And it is also a really interesting thing to find that 22% of respondents, they do not know or they do not practice proper hygienes when they change their menstrual pads. Next, please. So how it looks like for Menstrual Hygiene Day in 2020. We use the theme of menstruation time pandemic because of the evidence they found based on the EU report pools. We then also working with adolescents, engaging them on photo, video, essay competitions. We did series of online training. We involve numbers of influencers on IG Live. We also work with governments, leaders, ask them on the webinars to present their perspective and the government policy. We also develop a TED Talk like video. We call it MHM Talk series, where we engage with MHM champions working on specific issues like inclusive MHM, MHM in emergencies, then try to share their experience working on MHM sectors. Next, please. So this is just to show you how we try to integrate OKI launching and promotion rather than having a separate launching and promotions. We integrate the OKI promotions on Menstrual Hygiene Day. We work with number of influencers based on the influencer workshop that we did back in February 2020. We also developed series of OKI promotional videos to then post on the Unicef and also other social media platforms. What interesting is that previous slide, please. One slide before. Okay, so what is interesting is that when we try to engage the adolescents, asking them to submit their photos, videos, or essay competitions, some of them using OKI as their topic. As you can see on the screens, this is a girls in some part of Indonesia developing OKI professional materials in form of video, photo, and they post it on Instagram, Facebook, or even TikTok. And lastly, we also engage with influencers. We try to engage with micro influencers at local level. For instance, in East Nusa Tenggara province, we work with Indonesian Red Cross Nusa Tenggara province and involve one of the local influencers that really well known to then promote OKI. At the national level, we work with macro influencers that have more that have more followers or YouTube subscribers. In this case, we work with Clarin Hayes. She's a doctor, and she's also very committed on menstrual hygiene management. This is to show you how Indonesia try to localize and contextualize OKI. In order to make OKI easier for Indonesian user, we are translating and developing OKI communication assets such as brochure, frequently asked questions, and many other related publications. Those publications will be shared on not only on OKI website, but also on social media platforms. As shown on YouTube, U-Report results, many girls expect to have more information on COVID. Therefore, we have included COVID-19 related information into OKI. This is to enable girls to get more correct information. As I have mentioned previously, Ministry of Education and Culture will post content around Menstrual Hygiene Day. One of the posts that will mention OKI with the associated links. So today, Ministry of Education and Culture of Indonesia will post around Menstrual Hygiene Day with OKI link. So we expect that it will generate more girls and also women to download OKI. I want to ask my colleague here. She's a teacher from Indonesia, Ibu Mina, to present her experience in promoting OKI in one district of Indonesia. Ibu Mina?
Can we go quickly because we don't have a lot of time now?
Yes, Eva. Ibu Mina, can you jump in?
Your microphone is mute.
Hello, can you hear me? Can you hear me, Mas Reja?
Yes, yes, please go ahead, Ibu.
Okay, hello everyone. I am Mina as a teacher in Indonesia. As a teacher, I have some experience in promoting OKI in Indonesia. In Indonesia, every school should has a school health program and adolescent health cadre. We can use exciting platforms, school health program and adolescent health cadre to promote OKI. There are school health program training that we could leverage to share information about OKI. Adolescent health cadre could be an agent of change among their peers and their family. Introducing OKI to school health program staff and adolescent health cadre at school level will definitely generate more new OKI users. The other side, I found challenges in introducing OKI. First is about handphone ownership. Not all students is allowed to own and use handphone. Internet data connection is also a major issue in several areas. Internet is not always available, in which limiting the use of OKI. The download page for OKI application is not available in the Play Store, not searchable. I also feel that OKI has limited feature for disabled boys and girls. Thank you very much, Mas Reja and Eva.
Yeah, so next slide, Eva, please. Yeah, so this is a lesson learned and way forward. We found that OKI launching and promotion is a process rather than just one-off activities. We will work together with other development partners, also with Youth Red Cross, to engage more girls and to expect more girls using OKI. We also think that the collaborations will increase sense of belonging of a products. As you know, that the Menstrual Hygiene Day is a collaborative work between various development partners. It then increase the sense of belonging. So they are now promoting Oki with their own platforms. Pandemic situations limit offline promotion, of course. So we expect that we can have more offline events to engage really face-to-face with girls. What next? We will have series of local activations conducted in next 1 up to 2 months. We also seek the possibility to improve OKI period trackers to accommodate the need from persons with disability. And last two things, we would like also to engage with government and private sector how to move forward with OKI. So I think that's from my side, Eva and Anu. Thank you.
Great, thank you very much. Thank you, Reza and Mina, for a very nice presentation. It was very good to hear all of you. Now we are going to hear from our colleague from Nepal Red Cross. If you are connected, we want to have you online. Over to you, Mr.
Hi, Eva. This is Suvexa presenting from on behalf of Nepal Red Cross.
Yeah, thank you. Go ahead.
Thank you. Happy Menstrual Hygiene Day to everyone, whoever is connected. I'm very sorry, my internet is a bit disturbed, so I might get lost sometime. Please have some patience. So can we go to the first slide?
Yes.
The next slide, please.
Okay.
So welcome to the this presentation, where this first slide shows the facts and figures on menstrual hygiene in Nepal. Menstruation is still linked to impurity, untouchability, and different social as well as cultural taboos, myths, it's still being practiced throughout the nation in some or other ways. Like menstruation is still associated with disease, bacteria, dirt, or like decay, and it's like impure blood, and yeah. So if we see the census of Nepal, around 10.4 million of women and girls are in the age of menstruation in Nepal. On average, 15% of adolescents and youth is 10 to 24 in Nepal use sanitary pads, and 84% use cloth, whereas 1% they don't use any blood absorbent. 9 out of 10 girls, they are like girls and women, they are the victim. I'm not quite sure if I can use the word, but like they face the social and cultural taboos. In many areas, menstruating women, especially in certain caste groups, they cannot like use the same toilet that the males in the family uses it. They cannot touch the temple, they cannot go to the kitchen, they cannot go to the religious sites, they cannot consume milk and meat products, they cannot touch animals, they cannot see mirrors. So there are different types of myths and taboos that's still ongoing in Nepal. And yeah, and like 71% of the females still practice chaupadi. Like chaupadi is like isolation, and the females who are menstruating, they stay outside of the home, either in the cow shed or some shed during their menstruation for at least 4 to 5 days. And it's still practiced in province number 6 and 7, like Karnali and Sudur province. That's the western part of the Nepal. Although like Nepal has officially banned the chaupadi in 2005, but still being practiced. Females in Nepal spend their 3% of their monthly income in menstrual products, so which is equivalent to like around 200,000 Nepali rupees, which is the average expenditure a normal family does in the education sector. Around 17% of the girls are aware about menarche in Nepal. It's a study done by Unicef in Nepal, and one of the study done by Unicef also shows that 52% of the girls drop their school during their periods. Eva, can we go to the next slide, please? This is one of the assessment that was done by UN Nepal after the pandemic situation in Nepal. It shows that like this is the study done in 900 quarantine sites throughout 66 districts in Nepal. Uh, since most of our quarantine sites are situated in these schools, uh, 50 like around 55% of the quarantine sites they lack MHM facilities. So on- because most of the schools they don't have adequate number of toilets and there are not MHM facilities. The quarantine sites are also being they also lack the facilities. So can we go to the next slide, please, Eva? So in the development context, what we were doing is since Nepal Red Cross is working in frontline in the MHM, we have been integrating MHM not only in development settings but also in the emergency setting. So we do have MHM friendly environmental policy in enabling policy environment. It means that we have MHM guideline. We have this international IFRC MHM guideline, which has already been contextualized and localized in Nepali version, and it's being implemented in Nepal. So Nepal Red Cross is working as per the guideline, and since we are working in 40 different districts with a number of projects, and MHM is being one of the part in all of the projects. It also is helping us to reach number of people with MHM education, either through advocacy, awareness, or through different innovations. And we also do have MHM Alliance in Nepal. MHM Alliance is a national network that was founded in 2017 with over 50 organized members covering around 80 initiatives. The Alliance works on awareness advocacy, education, policy development, innovation, and research around menstrual health and hygiene in Nepal. Nepal Red Cross is also one of the active members in the Alliance. Since its formation, Ministry of Water Supply and Ministry of Women and Children are on board of this alliance. So we also have a government ownership in the MHM activities. We are also having a national level webinar in next 1 hour or after, yeah, in next 1 hour. So in the pandemic situation, Nepal Red Cross is distributing hygiene kits, especially to females and women who are in the menstruating age in the quarantine sites. And we are also we are also including MHM items in the combo pack. So while distributing this food items or non-food items to the people in the quarantine sites, we are also including MHM items when we see when we see the needs, when we do the assessment. If we see the needs of MHM items, we are also including them. We are doing the 4W reporting to the national as well as provincial watch clusters. So all the sectors, all the organizations working in watch clusters, so they can understand what's the need going in the national as well as provincial level. As well as we are currently we have placed an order for 2,000 sets of hygiene kits, which also includes MHM items. And we will be distributing this as throughout the nation as well as per the need. So this is the infographics that's also available in our official website. So it says that we have reached 300 females with hygiene kits, and we have distributed 3,500 sanitary pads and 700 cotton undergarments through this throughout this pandemic. This is the infographics that was done on 25th of May. So this is, we have not yet been able to update the new data. So we'll come up with the next one once we get the information. So can we go to the next? I think this is the final one. So So the decision, like for me, if I have to give my view on it, so all the decision makers in every organization should ensure that MHM items should be declared as essential and remain available, as it is very difficult not only for the patients in and like health workers in hospitals and quarantine sites, but also the community to obtain the menstrual hygiene products. So as we are working in the MHM sectors, we must address the potential loss of access by ensuring adequate supplies. With this, I would like to end my presentation. If you have any queries, I would like to request you to drop it in the chat box. Thank you so much.
Thank you, Suveja. Thank you for a very nice presentation, well thought, and also great to see the alliance and what you are doing. The last one, please, if you allow us 10 minutes to conclude, let's give the floor to Brianke Enrique for the presentation from Philippines. You have 5 minutes. Over to you.
All right, so good morning, everyone. This is Brian from Philippine Red Cross. Iwan, if I may request that I'll manage the presentation. If you can stop sharing your screen, I'll upload an updated version of the presentation, please.
No, let's stick to this one. We don't have a lot of time, please.
Okay, sure. All right. So just to give an update for everyone, presently, one of the goal of the Philippine Red Cross WASH unit is to have a massive information dissemination sessions and workshops on good menstrual hygiene and social media campaigns. So the picture that you are looking at is one of our ongoing initiatives when we talk to the girls during a disaster operations. This is being held in one of the evacuation centers in the earthquake affected region in the Philippines. Next slide, please. All right. So also, in response to COVID, as we adapt to our existing response plan, we develop a holistic or multi-sectoral response plan, which include the conduct of the hygiene promotion activities and the provision of water and sanitation facilities in hospitals and markets. As you can see here in the presentation, uh, one of the initiative or part of the hygiene promotion intervention is to ensure that menstrual hygiene knowledge will be disseminated properly to the specific target group of individuals. Next slide. So the context here in the Philippines as we adapt to the situation, the COVID is a nationwide concern. There are areas that have been identified lockdown or under community quarantine that has been affected by the situation. So it also put some factors that affects the access of people or girls in terms of essential hygiene items that includes menstrual hygiene pads, especially those family members or households that are mostly marginalized and vulnerable to the situation because of the socio-economic situation. Then there are also pre-pandemic situation that we have an ongoing disaster operations like in the case of Marawi siege, the Al volcanic eruption, and typhoon operations in southern part of Luzon Island. Next slide, please. Next slide. And then one of the key learnings that we have in this COVID-19 response is how we adapt our mechanism to the context in observance of physical distancing, making sure that that our existing tools or strategies are in line with the government or with the authorities in terms of conducting our face-to-face sessions. Then we also scale up the distribution of menstrual pads, especially for those with socioeconomic challenges. Next slide. Then part of as we continue to embrace the change, the adaptation to the new normal, we wanted to resume the partnership plan and actively involve with the private sectors as we establish these particular things during the pre-pandemic situation. And one of the things that we have to keep moving is to adapt and develop our virtual platform to reach out to the target group in terms of providing menstrual hygiene interventions to not only to the specific to the girls, but also it encompasses because it involves everyone. It is not only limited to women or to girls, but it's the responsibility of every citizen to make sure that people who are having periods should have adequate access to menstrual hygiene pads, to facilities, and also the support in terms of mental or psychological capacity. So those are some of the presentations that we have from Red Cross, and unfortunately I cannot show to you the pictures what we have this morning in observance of Menstrual Hygiene Day. Thank you.
Thank you very much, Enrique. Very nice presentation. Now over to you, Ludovic, to facilitate the last session and then the closing. Over to you.
Thank you, Eva. So we are a bit behind schedule, but I think it was very good to spend time on this presentation that we have today, and as the topic is very important. So let's move for the question. First, the first question to Anu was how was the information of Myanmar for MHM knowledge collected?
Thank you, Ludovic. So this study was based on a sort of, desk review, as well as some primary information collection from some of the organizations and the NGOs involved in countries as part of the virtual conference, and also some sort of survey with some school children, but this was not a very broad kind of primary data collection. This was more perceptive information collected from the secondary sources. Over. We can share the report with colleagues that has all the details on the scope and the methodology of the study. Over.
Thank you, Anu. The next question is to Gerda. So how was the participant and user data of adolescent girls protected at the back-end system of the app as part of data privacy? And also which user or human-centered design principle were used while designing the app?
Thank you so much for the question. To the first one about data privacy, that was one of our core focus. And that's why we opted that girls' data, anything the user enters, does not leave the app. It's stored locally and thereby is password protected. And there is no cloud where these information gets stored or possibly misused. So that's very different to every other app where you can enter personal data. We do have, however, we do collect aggregated user profile data, so we know how many users we have and what kind of areas they visit and how often a month they use it, but that's anonymized and aggregated. And for the human-centered design, there is amazing principles and tools and processes available that we are happy to share with anyone who's interested. Please do get in touch and we'd be happy to share those guidance and tools that has helped us to engage and make this a really user-centered process. Thank you.
Thanks a lot, Gerda. The next question is to Reza. So how has the response been since the launch of the Oki apps in Indonesia? And I will add also any idea of the number of downloads. So download maybe through direct link or through the app, the Apple Store. Sorry.
Yeah. So the launch and activation is just started since early May. So we haven't got much response, but some followable response we got from a disabled group that perhaps want to have Oki, more user-friendly for disabled persons. So that is one. The other is about the easiness to access Oki on Play Store. Up to now, it's not searchable. I think it is because Oki hasn't been reviewed so much, so it hasn't appeared on Google Play Store. So I think that's all from my side. Thank you.
Thanks a lot, Reza.
Yep.
I don't think we have other questions. So maybe let's go for the conclusion. So today, the day of the Menstrual Hygiene Day, we have the chance to have rich presentation sharing various experiences on menstrual hygiene management, not only during COVID-19. So COVID-19 is keeping us very busy, and we cannot forget that the current pandemic further exacerbates the menstruation-related challenges many women and girls face around the world. So, as we call it, periods don't stop for the pandemics, and we have seen during the different presentation how it is critical to include menstrual hygiene in COVID-19 emergency operation, but also beyond. Thanks for the presenters. Thanks for all the participants. So today we reach around 55 people. So I will conclude this webinar by wishing you a very good Menstrual Hygiene Day. Thank you.
Thank you, Ludovic, and thank you, Anu. Thank colleague for your highly participation, and then see you for the next webinar. Over. Bye-bye.
Thank you very much. Thank you to all
Bye.
the presenters. Excellent presentation. Thank you all for your time as well. Okay. Number 55 participants. But some town is which is good. Nice.